we start with a new client. We do a movement assessment and we try to figure out what limitations somebody might be having or what capacity limitations there might be. So there's a mobility. If you're having pain maybe in your back, you might be missing some hip mobility, right? Or if you're going for a run and you're having some knee pain, maybe your joints or your tendons or your ligaments don't have the capacity to take, like, let's say 5 to 8 times your body weight, which is what happens when you run, right? You put that much on one limb when you go for a run, and if you're not prepared for that, that's a capacity issue. So we start by assessing both of those things, mobility and capacity, right? And then what I do is I use my understanding and our current understanding of pain with what is called therapeutic neuroscience to help you understand why you might be having pain. If it's something that's more acute, or if it's something that's more persistent, that's been bothering you for a long time, it's important to kind of tease those out and kind of understand why we're having that pain. And then we'll move on to some of the biomechanics of it, like looking at how you're moving and breaking that down. Because sometimes when we're lacking different options for our joints, so the spine is meant to rotate and flex and side bend, right? And if we're not able to capture those motions adequately, over time we lose maybe the variability of that. And so what that can do is potentially add repetitive stress or load to one segment of your back or one area. Over time that can sensitize it. So instead of thinking about it, oh, it hurt or it hurts and so it's damaged, it's more like, I like to tell people, like, we aggravate things, right? So we got to calm them down. And one way to calm that down is to give you more options. And so that's where some of the biomechanics comes in. And then once we kind of give you something that you can consistently work with that is, getting you back to those activities that you like to do, then we sort of exercise and load it. So we kind of ramp up the capacity, because now you have new movement options, then we increase the capacity, and then we progress in exercise.